Hi everyone, Dr. Moses here, general pediatrician. I'm going to be talking about autism today, specifically speaking autism spectrum disorder. That's the term for it, autism spectrum disorder. But you may hear me use the word autism throughout this topic. So broadly speaking, autism is defined as a neurological and developmental disorder, right, that is characterized by persistent deficits in social interaction and social communication, persistent deficits with repetitive and restricted movements, interests, and or activities. So that's the broad definition of it. Now, what that means is essentially what this talk is going to be about. I'm going to break it, down the presentation, how we diagnose it, and things like that. We don't know the cause of autism. Let me just get that out of the way. There are a lot of research that's been going on over the past 20 years that's shown a lot of genetic predisposition. There are a lot of genes that have been identified in certain children that have autism. We've seen, parents that have more than one child with autism, basically telling us that there may be a genetic predisposition, meaning if you have one child that has autism, the likelihood of you having another one that has autism is a little bit higher. We've seen twins where both of them have autism. So certainly we know there's a basis of genetics in it. Another thing that we know is there's some environmental basis as well. We've seen autism that's slightly higher in advanced maternal age, older mothers. We see a higher chance of autism there. Babies that are born extremely premature, babies that maybe had some sort of oxygen deprivation at birth, have a higher chance of autism. So all of these things are environmental factors, but there are other babies that have some of these same exposures and some of these same risk factors that don't have autism. So that's why there's really no black and white cause of autism. It's a mix of environmental and genetic things. That being said, we know autism is not caused by parenting styles or the way you discipline your child. So don't believe it. We know autism is not caused by vaccinations. There are way too many studies that have been done by different scientists, different biologists, different, medical people from different continents that have done these studies over and over again that has shown no link between vaccines and autism. So again, I just want to put that out there. There's been no link found between autism and vaccines. Now, what is the presentation of autism? So number one, social emotional reciprocity. So what that means is the child doesn't really understand emotions. They don't understand how you're feeling. When you smile at a baby, they smile back at you. When you laugh, they may laugh back. The older kids, when you cry, they may show some sort of concern. So in some kids that have autism, they're unable to reciprocate the emotional awareness. So when you smile at them, they may, frown or look away. When you're crying or showing a heightened expression of emotion, they may not even acknowledge that that's happening. They may not be able to reciprocate back and forth discussions or dialogue with you, in kids that are able to talk at this point. So essentially, it's a lack of awareness on the thoughts and feelings of others. Another thing that we see is nonverbal communication. So these children certainly have difficulties making eye contact. There are times you may make a face at a child and like, do something like that, and the child responds. You do that to a kid with autism, they may not even show a reaction to that. When you try to talk to them, they don't make eye contact. When something sudden happens, in a room, maybe there's a loud bang or a loud sound, one child may, respond and look around to see where the sound came from. A loud bang happens, a child with autism may not even acknowledge that loud sound. Something else we see is the tone of voice may be too high or too low. A child with autism may always use their outside voice, even inside the house. They scream when they talk, or they yell certain things out loud, or they may speak in a very monotone and low voice. Something else we see is just a strong difficulty developing, social skills and social interactions. So they may have difficulty adjusting in social settings, showing a lack of interest in social interactions with other kids. You may be at a birthday party and all the kids are running around, but the one child is like in the corner, just standing there playing by himself. There's basically no understanding or awareness of their social environment. Now we see something called stimming, or stereotypes or repetitive behavior. So you may see a kid that does one of these things like flap their hands, just for no reason. Some kids may spin around just instead of playing with friends and things like that. You see them standing in a spot and just spinning around in circles non-stop. You may see them have something called echolalia, which is repeating the same thing over and over again. Hi John, hi John, hi John. They just repeat the same sentence or repeat the same phrase over and over again. So we see like repetitive things. Now we also see kids that insist on sameness. They eat the same exact thing every day. All they want to eat is mac and cheese. If you offer them anything else, they refuse it. They don't want to eat it. They may even throw tantrums. So they insist on sameness. They have difficulties, changing rituals or changing routines. So some kids may have highly fixated interest in something. They may have like a train set that they play with, and they're so fixated on moving the train around or watching it move around, and they could be there for minutes, even hours on end, just watching and fixated on it. They may have a toy car and just literally sit there and roll the tire over and over and over again. Some kids have sensory issues where they have a heightened response to certain things, or a very diminished response to certain things. So a perfect example is the sound of a vacuum cleaner. You turn it on and they have just like cover their ears and have just an exaggerated response to a sound where another child may not have that same response to. And the other thing is, these behaviors and presentations, we typically see it in early childhood. There is a evaluation that's done, for kids that are 18 months. Right? So autism, we start seeing the signs as early as 18 months, and kids that are very, very obvious, you can see it even before that. But around 18 months is when we do that initial screening test that your pediatrician should be doing with you, which is a questionnaire that you fill out as a parent, and we review it. And if it shows that your child has a high chance of having autism, then you'll get referred to a developmental specialist, a neurologist, a psychologist, a neurodevelopmental specialist, someone that is able to go through the whole evaluation process to give you that diagnosis of autism. Other thing is, the most important part of autism is early diagnosis. The earlier autism is diagnosed, the better kids can have access to certain therapies that they need, because the earlier the therapy, the better it is on the long run for the child. So if you feel like your child has autism or has some sort of developmental impairment, make sure you see your doctor as soon as possible. Now, in terms of treatment, again, there is no treatment for autism. Unfortunately, it's a lifelong condition, and the remedy really is therapy. Where is that child deficient? Are you deficient in the social aspect? Then maybe that child needs therapy that works on interacting and integrating them with other children. Or are you delayed in speech? That's a kid that needs to be in speech therapy. So whatever your deficits are as a child that has autism, the whole idea is that they get therapy specific, to whatever it is they're having issues with. Now there's something called ABA therapy. I'm not going to go into that. That's again specific for children that have autism. There's certain medications that are available for certain children that have autism, but those medications are to treat whatever those behaviors are. Some kids get very irritable, very aggressive. So there's sometimes they may need to be put on medication in addition to therapy to help, manage some of those behaviors that they're having. Last but not least, so it's very, very important that if you are concerned that your child may have any kind of developmental issues with social interaction, some of those repetitive behaviors, even walking on their tiptoes, that's another thing that we see with kids that have autism. But there are kids that are completely fine that also walk on their tiptoes. If you have any concerns and you feel like your child may have some of the things we talked about here today, make sure you have them see their healthcare provider as soon as possible. Now, in those kids where autism is very subtle, we may not diagnose them until they're 5 or 6 and things like that. Those are the kids you may hear the words high functioning autism, but again, once that diagnosis is made, whatever issue it is they have will be addressed at the time. But the earlier the diagnosis, the better on the long run. that is all for now. Until next time, stay blessed.